welcome to Bird Flu Part 3. Here with me again is Amber Bell. She's a doctor of science in physical therapy. And I'm Dr. Clark. Well, what did you think of those last two presentations?
Very good. I really enjoy learning about prevention. That's an especially important topic. And understanding what the bird flu does to the body is going to be very helpful for treatment.
Sure is. And hopefully you never get to this point. You followed all the stuff on prevention that we talked about in the first talks. But inevitably somebody's going to come down with the bird flu and you may need to treat them. So we're going to go through this step by step and tell you what to do. But before we do, I just want to bring this closer to home. I was up north in Maine. I was looking around in a graveyard of all places. And wouldn't you know it, there was a gravestone from 1918. And the gravestone had on it that this person had died in Fort Devens, September 27, 1918. And this could be none other than a casualty from the 1918 bird flu. So we're going to do a lot to learn from the 1918 bird flu. And whatever we can learn, we'll pass on to you, and hopefully we can avoid the casualties that happened back then.
Say I'm starting to get the flu. What type of symptoms would I be experiencing?
Well, Amber, usually the flu starts off with a lot of aches and pains. Your muscles hurt, and you might have a sore throat. Also, you can have a headache.
Okay.
You just feel generally a little bit run down.
Say these symptoms start to get worse. What could I expect to happen?
Progressive symptoms include a worsening sore throat, and you'll have a headache that'll get worse. It might be more behind your eyes than anywhere. Your whole body aches will increase. Also, your eyes might start getting red. A lot of people get what we call conjunctivitis. That goes right along with the flu.
So it sounds like the symptoms that we've talked about just get more intense, and then
Yes.
you start to add possibly eye symptoms and that sort of thing.
That's right.
Anything else start to happen to the body? For instance, your temperature, does that get affected by the flu?
Yes, Amber. The temperature often goes up, and it could go as high as 103. People get chills, and chills are really a sign that you're colder than you want to be. It means your body's trying to produce the heat to raise your temperature. And then you get worse malaise, we call it malaise, exhaustion, tiredness. Oh, I don't feel good. Oh, I just want to go lay down. A cough might start. This is a sign that it's affecting your throat and your lungs. Cough is not a good sign, but this can be a regular flu as well as the bird flu.
Okay.
People lose their appetite. And this is something that the flu bug does to people. And along with this comes nausea. And so it's generally a bad picture.
As these symptoms progress, is there anything more?
Well, yes, and the regular flu gets worse often too. They'll be vomiting. People are throwing up. People get a runny nose. It's kind of any viral illness tends to cause that. And you get postnasal drip and going down your throat. People with the flu will get abdominal pain. They might even get diarrhea, cramps, mild chest pain. And the chest pain could be more with the bird flu than with the regular flu.
Okay. Now, what type of symptoms did they experience back in 1918 with the bird flu?
Well, 1918 bird flu was pretty dramatic. And what happened then is it started out like the regular seasonal flu, but instead of getting over it by the third or to fifth day, the patients continued to have fevers, progressive shortness of breath, a lack of oxygen in their circulation, causing kind of a blue color all over their body. They call it cyanosis. And oftentimes they would be coughing up sputum that would be frothy, red tinged, pink tinged, a little blood. Very ominous signs for a flu.
Okay. So it sounds like in 1918 it progressed pretty quickly past the normal symptoms to these more severe symptoms.
Yes.
Anything else that goes along with these more severe symptoms that we should be looking out for?
Yes, if you're getting the bird flu, one of the things the people particularly complained of was that they had a headache right behind the eyes. It was like a searing headache, a headache that just wouldn't go away, and the fever would continue to raise, but in order to raise the fever, they would get some really what they called shaking chills, uncontrollable shaking. And this was talked about quite a bit. Teeth chattering, bone shaking, terrific pain almost everywhere, and joint pain with agony, they described it. Burning pain just above the diaphragm, if you can imagine, right above your stomach. And this, of course, is the base of the lungs. So very, very progressive. Then the heart would start beating really hard. We're talking pounding, fast. We call it tachycardia and palpitations. But people would get problems with their hearts because the virus would attack almost every part of the body. The brain, people would get meningitis, delirium, severe headaches, earaches, and dizziness. They would get bleeding from the mouth, the nose, eyes. They would talk about these people coming to see the doctor just red with blood everywhere. Nosebleed. And sometimes the nosebleed would be projectile. It would seem to squirt. It was just...
It sounds like this flu is attacking all the major organs and membranes of the body.
Yeah, attacking everything. On the abdomen, they would get intestinal bleeding. As the intestines would break down, they go into renal insufficiency and back pain. Just a major deterioration in health.
Now you mentioned the pain above the diaphragm and the bottom of the lungs. So it sounds like this is really a lung problem, that the virus really attacks your lungs. Are we going to notice symptoms from that?
Yes, the lungs are especially hit. They would come up gasping for air. They'd be turning blue. They'd be coughing up blood that would be originating from the lungs. They would have this foamy sputum.
Tell me a little bit more about the complications with the lungs.
The lungs were especially hit first by the virus. And if you could see a picture of what the lungs looked like before the virus came along, it would look like a whole bunch of like sea anemones. We're talking a very high power micrograph or electron micrograph. Cilia that would move the mucus out of the lungs. But after the bird flu came through and hit the lungs, it would look like a desert.
So it just destroyed all those cilia.
Destroyed them all. That's exactly right. And so this would be what we'd call a viral pneumonia. And the viral pneumonia would end up destroying the lungs and cause them to start bleeding. There's reports of patients dying within 24 hours of getting this flu. But then if they survived the flu, within a month they could still get a pneumonia from bacteria.
Because their immune system was so drained from fighting off the flu, it seems like that would just be a breeding ground for anything that could come in and attack the body at that point.
Yes, that's exactly right. And the influenza virus especially attacks the immune system.
So basically, if you survive these symptoms, you're still not out of the woods yet.
That's right.
Okay.
You could still be dying of pneumonia.
Tell me a little bit about what conventional medicine does as far as treatment, maybe back in 1918, what they were using or what they might use today to treat these types of symptoms that go along with the flu.
Basically, we're looking forward to treating the bird flu with what we've been treating regular flu with.
But it sounds more severe.
That's right.
Well, tell me what they're using for treating the regular flu.
First of all, we put them to bed. We start having them take fluids. If they came to the hospital, it'd be an IV. If you're home, it'd be drinking water. We have them take a few things to try to get the fever down, usually pharmacological agents like acetaminophen or Tylenol. We discourage aspirin because it has some side effects in a patient with a viral illness that aren't good. Decongestants, you know, people run for their Dimetap and their ephedrine or whatever.
Yep.
There's cough syrups. People have their favorite cough syrup, their favorite brand, and then there's antivirals. These we'll talk a little bit more about, but these are pills that are designed to fight the virus themselves. Then if a patient was to get some kind of secondary bacterial infection, we would have antibiotics specific to the particular bacteria that was attacking the person.
Such as pneumonia or...
Yes, pneumonia, yes, or bronchitis. That's exactly right.
Okay. But you said they send the patients to bed. Is that probably the best treatment for the patient?
In studies in animals where they've given the animals the influenza and they used two groups, one group got to exercise and the other group got sent to bed, the ones that went and exercised actually did better. More of them survived, less of them died. And so we're wondering if a little exercise, we're not talking fatigue, but some movement, especially outside in the open air, wouldn't be good for patients.
Okay. Keeping up the fresh air.
Yes,
sort of
fresh
thing.
air, that's right.
And you mentioned also acetaminophen or Tylenol.
Acetaminophen or Tylenol has the potential to exacerbate the consequences of any viral infection. It decreases the immune response to the viruses.
So it actually hurts your immune system.
It does.
Okay.
It actually does. It can also hurt your liver as well. So getting your temperature down through pharmacological means may not be
The best option.
the best option.
Yeah. You also mentioned antivirals. I would think, man, that's a great idea. I'll just go out and take something to fight the virus.
That's right. Call in the troops and
That's
send them
right.
after the virus. And there's a number of them on the market. There's some older ones, amantadine and ranitidine. Bugs no longer respond to those. Our most recent ones are Tamiflu and Influenza. Tamiflu, I remember when it came out. It never was marketed as, the army to go chase down the bird flu. Although we've kind of assigned it that role in this new oncoming pandemic. So there's still some questions about that one for sure.
Okay. Well, say we do produce the antivirals. Are there enough for everyone to be able to partake of the medication, or how are we going to get a hold of these antivirals?
The government has been trying to get them to produce more. There's a lot of stockpiling going on. Right now we got about 25% of what we need to treat the population. We hope by 2008 to have enough to treat everybody. So we're looking at shortages.
Yes. Have they done any studies with these antivirals with certain populations and human populations to see if they affect the flu?
Well, we have these cases over in China, bird flu, that have been happening, and in Vietnam and in Indonesia. They've been handing out the Tamiflu to people with the bird flu. The way you're supposed to give it is you're supposed to give it the first day that symptoms show up. They've done that, and people have still died. So they're worried that there's some resistance.
What about in 1918? Were they able to find treatment options that affected the people with the more serious bird flu?
Well, they tried a number of things. Dr. Alfred Stengel, infectious disease expert, told a bunch of medical students in 1918 they had tried gargles, that is, mouthwashes. They had tried drugs. They had tried immune sera. Everything they tried seemed to make no difference at all. They basically said they were doing supportive care.
Okay, so basically the things like you were saying, addressing the symptoms, trying to get the fever down, or trying to stop the cough, or maybe give antivirals, but nothing seemed to really affect the people with the bird flu.
Nothing seemed to work. That's exactly right.
Wow. Well, say I'm coming down with the bird flu. What do we suggest we do?
Well, that's a good question. We haven't held out a lot of hope, have we? First of all, I want to talk about what I do if I feel I'm coming down with the flu. And then I'll tell you that this is based on science, has been studied. Dr. Charles Thomas at Loma Linda and Dr. Joachim at Mayo Clinic did some studies on this. But what do I do? If I feel like I'm coming down with the flu, I head for the shower. That's my most available hydrotherapy unit in my house. And I'll turn on the water as hot as I can stand it. And I'll stand there until I feel my temperature go up. Now you may wonder how I know my temperature's going up. Well, one time I did put a thermometer in my mouth and I kept track and could tell by the way I felt what my temperature was. Now if you can't tell, you just get a thermometer and put it in your mouth. You want to raise your temperature a little bit. I wouldn't raise it over 101. But just seeing it go up some, if your temperature's already up, that's fine. Just wait till you feel a little worse. But anyway, you get your temperature up a bit, and then you switch to cold.
Okay.
For 1 minute.
Okay.
Since the flu usually comes in the winter, my cold water is very cold. But you get the water cold and go for 1 minute. You can time it. You can count to 100 or to 60 by whatever. Just get your minute down, and then I'll do this 1 or 2 more times. I'll get my temperature up and then hit it with cold, and then after I've done that and I've finished with cold and I've dried off, I'll go to bed for about a half hour. And I tell you, it feels like you have taken a really strong medication.
Your body really responds to this.
Oh, yes.
I think I would, especially with the cold.
Especially the cold. That's right. Don't skimp on the cold.
So it sounds like this is a way to just catch it right at the beginning. If you can catch it right at the beginning, you may have an influence on getting your immune system up and be able to catch it before it progresses through the body.
That's exactly right. And the studies they did where they actually drew the people's blood after doing the hot and cold showed that they raised their white count. The white count is the cells that are part of the immune system.
So you've explained that when I start to feel those symptoms of the flu coming down, that general just achy, uncomfortable, sick feeling, getting right in there and taking a good hot and cold shower can really raise my immune system's ability to fight off the flu. Are there any other things I can try right at the beginning to address the flu?
Well, I'm glad you talked about it at the beginning. We say a stitch in time is worth 9. And if your pocket's coming off, if you can keep that first stitch from unraveling, you're way ahead of the game. Well, that's definitely true with the bird flu, or regular flu as well. If you can catch it at the beginning, you're way ahead of the ball game. Because if you wait till you have blood coming out your nose, oh man, you'll see we have some treatment for it, but
Try and catch it at the beginning.
Oh yes, try and catch it at the beginning. But there is something else you can do. Believe it or not, charcoal is a big help. Charcoal is something that binds viruses. It has a ability to adsorb a lot of things onto its surface, and charcoal binds viruses. So what I have people do is take a glass of water. I usually use a jar so I can put a lid on. I'll put 8 ounces of water in a quart jar. I'll put in 2 tablespoons of charcoal. May seem like a lot, but it's all right. And then I'll screw the lid on tight, shake it so it's all intermixed, take the lid off, and drink it down.
So you're talking about charcoal powder then, it sounds like.
Yes, exactly.
Probably wouldn't take 2 grill charcoal pieces and throw it in there, so it makes sense. You're just mixing in the charcoal, mixing it up, and then you actually drink that right down.
That's right.
Okay.
Yes, don't take the charcoal out of your grill. You have to get the charcoal. Get the charcoal from health food store, or you can buy it online. Charcoalremedies.com
okay.
is a good source. And
is there a particular brand or type that I'm looking for?
Well, you would prefer to have a hardwood or coconut shell charcoal. You don't want bone meal charcoal, which they do sell.
Okay.
Most of the charcoal you find will be that way. You can buy charcoal capsules in a lot of stores. I haven't really tried those. To get 2 tablespoons would take a couple bottles of capsules, be quite expensive.
So we've talked about the hot and cold shower and the charcoal really upping our immune system and binding and taking those viruses right out of our body. Are there any other types of treatments that we can really hang on to, or things that we can do to prevent this from progressing?
In our second talk, we talked about prevention. And we mentioned the 8 natural doctors. And those were pure air, sunlight, abstemiousness, rest, exercise, proper diet, use of water, and trust in divine power. And this would definitely be a time to make sure you are acquainted with each one of those and practicing each one of those, because each one of those stimulates the immune system not only for prevention, but also for cure.
Okay.
So remember those.
You mentioned fruits and vegetables and diet. Tell me a little bit about what is required in diet to strengthen the immune system.
Yeah, let's review that a little bit. Besides the whole list of things we gave in the last talk, when you actually come down with the flu, we don't want you to necessarily overeat. We're thinking that you want to have a more sparse diet. In fact, if you feed animals less that have the flu, they survive better.
It's a little bit of calorie restriction then.
Yes.
Okay.
And we're talking especially junk, empty calories.
No sugar.
No sugar. Eat things that are especially nutritious. Vegetable juices would be a good one. Fruit juices might have too much sugar.
Yeah.
But vegetable juices, choose foods from the previous lecture if possible. Things that are high in vitamin A, vitamin E, selenium, zinc. There's other things you can eat too that are helpful, especially garlic. It keeps the flu away, keeps the friends away.
Keeps everything. Maintains that quarantine distance.
There you go. Well, there's a report in 1918, 20 people ate garlic with each of their meals, and none of them came down with the flu. And none of them had any friends at the end of the time either. No, not really. They all were friends. So
Right,
they,
there
you
you
know,
go.
if you can't beat them, join them.
That's
yes.
right. So you mentioned diet as a big component, and I suppose it's not probably what you eat so much as what you don't eat. You mentioned staying away from sugar,
Yes.
which also can probably lower your immune system. So
That's right.
That's important. What else? You also mentioned fresh air. How does
Yes.
fresh air affect your immune system?
Fresh air is important, and I don't know if it's so much fresh air helps your immune system as it is bad air depresses your immune system. People
yes.
who are in polluted environments with lots of chemicals, have poor immune systems. But people who get out in the fresh air do a lot better. They get out in the sunshine, they get out in fresh air. It helps their immune system. The studies have shown it increases the effectiveness of natural killer cells against the virus. So, and you can drink a lot of water too while you're at it, and water helps increase your immune system's ability to fight the flu.
I like what you said about not being in the environment of flu, because there's probably a lot of viruses around. If you're breathing in and out, there's probably a lot of viruses around you, so getting out in the fresh air probably reduces the amount of intake.
That's right. If you can change the air in your room, you reduce the virus level by 60%. If you change it twice, you reduce it by 90%. If you walk outdoors,
you get all.
you get it all.
Air.
That's
All
right.
So you also mentioned prayer, belief in a divine power. That also is effective for your immune system and for fighting off the flu.
It sure is. People who are prayed for also do better. They did some study on patients in the ICU. The ICU patients were prayed for, some of them were prayed for, and some of them weren't. The patients who were prayed for required significantly less ventilator assistance, antibiotics, and diuretics. Praying for patients is, if I'm coming down with the bird flu, I want everybody praying.
So it sounds like there might be someone up there helping you out. The man who created the immune system.
There you go.
The great healer. So you've addressed, prevention, which I think is very, very important. Because like you said, a stitch in time saves nine. It's much better to catch it at the beginning. But if I do start to progress with the symptoms of the flu, and I'm not able to stop it with the hot and cold baths and the charcoal and the diet and fresh air and sunshine, is there help? What can I address? You said some of the conventional stuff just isn't quite cutting it with the people who have it over in Asia.
That's right. It wouldn't be that modern medicine wouldn't have answers. It'd be that the answers are too few and far between. You may be stuck at home in quarantine. You may need to know this stuff for your own good, even if you have the best doctor in the world just right around the corner. You may be sick too.
Right.
So you need to know what to do for yourself in this situation.
Okay.
So we do have some things that we can do, and we learned this from the 1918 flu. While the hospitals were losing many of their flu cases, the non-medical hospitals, such as John Harvey Kellogg's Battle Creek Sanitarium or McFadden's Health Restorium, were getting almost 100% healings with their water cures, baths, and enemas. If we could follow their methods, then we might at least have some success.
Yes, definitely. If someone has treated it already, let's look to what kind of results they got.
First of all, we'll talk about the ones that got pneumonia, because that's kind of the sentinel event, and then those that died. So of the bird flu cases, those that went to the Army hospitals, which were the best hospitals in 1918, 17% of the patients got pneumonia. Of those that did hydrotherapy at home, hot and cold treatments that we're going to talk about, only 9% got pneumonia. Those that went to sanitariums, a Meta-Center study covering 10 sanitariums, only 1% of the patients with the flu came down with pneumonia. And so then, if we talk about mortality, of the influenza cases, those that went to the Army hospitals, 6.9% died. These are the ones that passed away, and this is according to this article. And those that treated themselves at home with hydrotherapy, 4% died. So this is about almost half. And then of those who went to the sanitariums, only 0.5% died.
Oh, wow. Significantly reduced.
Yes, significantly reduced. Well, John Harvey Kellogg is kind of our model here. He wrote a very big book on hydrotherapy called Rational Hydrotherapy. He wrote an article in his magazine called Good Health in November of 1918. Remember, the bird flu had its heyday in September of 1918. Well, he wrote about a 3-page article on how to treat the bird flu, the Spanish influenza. His article was called Spanish Influenza Treatment. At the end of the article, he said, if the foregoing measures are intelligently applied, the deaths from Spanish influenza or from pneumonia following it will be negligible. So he felt that if you followed his advice, which he had tested during the previous wave of the flu, that there'd be very few people would die. And in fact, the statistics bear this out.
Okay.
Hydrotherapy used to be a big part of physical therapy.
Yeah.
And
Use it often still in the hospitals for wound care, for encouraging circulation and that sort of thing.
Great. Well, hydrotherapy. I've heard of a water. What is hydrotherapy?
That's a great question. Hydrotherapy, hydro, water. It's the use of water in any of its forms, hot, cold, that sort of thing, for maintenance of health and the treatment of disease. So basically, hydrotherapy is using water to treat illness. Hot water, for instance, can be applied to the body either with hot packs or foot bath, that sort of thing. We'll talk about the different methods, but hot water can be used to dilate local blood vessels and increase blood flow to that area to relieve pain, congestion, muscle cramps, inflammation. Basically, it moves blood by attracting it to the place of warmth and by a reflexive reaction. And cold water, similar principle, it's used to constrict the blood vessels and decrease the blood flow to that area, and it moves blood away from the area, the local area that you're trying to address, the reflexive reaction.
Oh, okay. So if I want the blood to move from this end of the table to that end, I'd make this end cold and that end hot, and the blood would move that way.
That's the principle.
Well, that's great. And perfect health depends on
Perfect circulation.
So we're really working on circulation.
That's right.
As a physical therapist, what hydrotherapy treatments are you going to talk about?
Okay. That's a great question. First of all, we talked about drinking water. Again, that's so important for flushing your body out, maintaining your liquids, your blood volume level, so that your blood can actually move from place to place.
Okay.
You want to make sure you have a good blood volume. The next one we'll talk about is steam inhalation.
All right.
We're going to talk about foot baths,
All right.
neutral baths.
Neutral bath.
Yep. We're going to talk about using heat as a leg pack and cold mitten friction rubs.
Okay.
We're going to talk about fomentations, and we'll explain that later. We're also going to talk about abdominal cold compress and a hot and cold abdominal pack today.
Wow, we're going to learn a lot today.
We'll go through it rather quickly. It's very helpful.
Oh, very good. Different things that you'll need that would be good to have is a thermometer. Actually, 2 thermometers. One to check the temperature of your water, and the other one to check the temperature of your patient. So an oral thermometer and a little, a candy thermometer is what I got.
Yeah.
Then you need some washcloths. You'll be using these to dry different areas. You'll be using these to soak in cold water and put on people's foreheads and different other parts of the body. You'll want a mattress protector. You don't want to get your mattress wet or whatever the patient's laying on. So we're talking one of these vinyl mattress protectors and a pillow protector. Kitchen towels. Have 6 or 8 kitchen towels around. Cold compresses, just getting cold applied to the body. You'll use them to dry. You'll also use them to keep your hot packs from getting too hot, heating the patient too much. Then there's these gel packs. I think those are very handy. Anything you can use for heat. Kellogg said, you can use the fomentation pads. That's what they used in the sanitarium, but he has a whole section on what else to use. Bricks. Anything that'll hold heat for a while. Water bottles.
Yeah.
Just anything, but I like the gel packs you can buy in the stores because they're usable. You can throw them in a microwave. You can throw them in the freezer. They're just so,
Versatile.
Versatile, yes. Then the cold mitten friction. You can buy these terry cloth hot mitts. That's what I use, and that's what I've got pictured here. Then you'll need some towels, just some regular bath towels, both for drying the patient, because some of these procedures you'll be drying them in between every application of hot and cold. But also some cases you'll use them to help insulate the patient from the heat or to hold the heat in. So have a stack of towels. Have a big source of heat. Now you may be boiling these gel packs or towels or whatever you're going to use for your hot. You may want a big canning pan, or you may just use your microwave, whatever. You need a source of heat. You can have a burner you can buy and put under your kettle. Blankets, 2, 3, 4 blankets. Some people prefer wool, but if you don't have wool, just whatever you can get a hold of. If you need more warmth, just add more blankets. And then you want some very nice cotton sheets. Here I have pictured a full sheet set that is called a jersey knit. That's because it'll cling tighter to the patient more easily and cut out any dead air spaces. Then there's flour sacks to fill with charcoal for the charcoal fomentations we're going to talk about. And then there's an ice dish. That is an ice dish. It is not a doggy dish, but you want an ice dish that won't fall over, so, you know, those doggy dishes work quite fine. And they're pretty cheap, actually. And a set of bowls would be nice for cold water, for warm water, for wringing out things. So that's some of the supplies I found inexpensively. Well, Amber, you mentioned on your list of things that we were going to learn about drinking water.
Yes, very important.
Why is that important?
Well, some of the symptoms that we talked about for the bird flu, you can address with drinking water. For instance, dehydration, of course, you want to make sure you keep your level of water up in your body. You also can positively use water for fever, fatigue, that general rundown feeling we call malaise.
Oh.
So water can be used for any of those symptoms with the flu.
Wow, what does the water actually do inside you?
Well, it's almost like an internal bath. It sheds waste from your body. It cleanses your body as you drink it. It also dilutes the fluids of the body. So you purify your body when you're drinking water. Increases your blood volume. It also increases blood cell survival and oxygen carrying capacity in your body. It also increases your metabolism.
Boy, I'm thinking I better look around for some water here.
That's very good.
That's very promising.
Excellent. It's not like you need a lot of equipment. All you really need is a glass and a bottle of water. What they recommend is drinking at least 10 to 16 8-ounce glasses of water a day.
Patients tell me they get 6 glasses of coffee. Does that count?
Well, you know, actually coffee can dilute the amount of water. You actually have to drink more water when you drink coffee, so it's not good for you.
It's a diuretic.
It is. It flushes everything. So you actually can get some water from fruits and vegetables. Hot water actually can be really beneficial for a cough. Neutral water is best for quick absorption. If you drink cold water, your body has to warm it up first, then it can use it. So drinking neutral temperature waters is good.
Well, you know, I'm just going to go tell everybody to drink a ton of water.
Yeah, well, be careful. There are some precautions.
Oh.
Usually you can't overdrink, but if someone has kidney failure, their kidneys aren't adequately filtering fluids, or congestive heart failure where they tend to take on more fluid anyway, you want to be careful with their fluid intake.
Hydrotherapy from the inside out.
That's right.
Wow. Now, you also mentioned steam inhalation.
Yes. For instance, if you were to have a teapot that made steam and to be breathing that steam in, that type of thing, that's very good for inflammation and congestion of the mucous membranes. Remember we talked about the cilia moving the mucus, which cleans out your lungs. When you breathe in warm steam, that actually helps the mucous membranes. It's good for runny nose, postnasal drip. It relieves irritation in the back of your throat, that moist air. It's also good for loosening secretions that have built up. It's also good for relieving spasmodic breathing.
Oh.
And coughing, and also prevents excessive dryness of those mucous membranes.
Well.
So steam is actually a very good modality.
Sounds like it. Well, now, where do I find this steam? How do I get it?
Getting a kettle or some type of vaporizer that you can boil water in.
Oh.
You can roll up a newspaper and use that to funnel the steam to the nose.
All right.
And oftentimes you can also use that to apply some type of medication like a vapor rub, or often the oil of eucalyptus, and put that on the inside of the newspaper so that as the steam is coming up, you get some of the medication as well breathed in when you breathe. If you want continuous inhalation, sometimes you can use a bedside stand with a hot plate so that it's right there with the patient and they can breathe it in.
I'll set this patient up. How shall I do this treatment?
Well, if the patient is maybe somewhat sitting up in bed or lying in bed, you can fill up the vaporizer or the kettle with the boiling water and basically carry it to the bedside, place it next to the patient, and then again use that newspaper to make a spout and just direct the steam right to the patient. And as far as them, usually 1/2 to 1 hour, 3 times a day is what they recommend. So.
Great. Well, and then you talked about putting some medication in the steam.
Yes, you can use oil from the eucalyptus, or you can use Vicks Vapor Rub, any of those types of things to, again, loosen up the secretions in the lungs.
And is this something just, anybody can do and everybody can do and no problem?
Yep, you want to be careful to check the inhalation often to make sure everything's going okay. You want to avoid the risk of burning because, again, the steam, if it's too hot, you can burn the patient. You want to avoid drafts during the treatment time. And extra care must be exercised when giving treatments to children to avoid accidents.
That's pretty simple. I think I could do that at home.
It's very easy to do at home.
Well, tell us a little bit about the next one you talked about or listed earlier, about the hot foot and leg bath.
This is one of my favorites. Even when you're not sick on a winter day, it feels wonderful.
Really?
Yes.
What would it do for me?
Well, if you had a headache
Yeah.
or eye pain, chest congestion, runny nose, chills, these are all the types of symptoms that you would use a foot bath for.
Oh, and what does the foot bath actually do to my body?
Well, you mentioned about using the table and putting hot water at one end and cold and the blood moving. It's very similar again. When you have your foot or lower leg in warm water, basically you're moving the blood to the feet.
Okay.
And what that does is it will relieve congestion and inflammation in your eyes and in your brain and in your chest. It also increases, remember that warm temperature, just like with the shower, increases your white blood cell activity, and the white blood cells are again part of the immune system which fights off the influenza virus. And it also provides a general warming to the body, even to the point of perspiration, which is one of your body's ways of eliminating waste and toxins.
Great. Wow. So, do I have to go down to the spa to do this?
No, you can do this right at home as well. The things that you need basically is a water container that's large enough to be able to fit as much as the lower leg in as possible, hopefully up to 2/3 up to the knee.
All right.
Again, you mentioned a thermometer earlier as the equipment, and this is a good time to have that thermometer. You want the water temperature between 103 and 110 degrees for the foot bath. You also want a blanket to keep the rest of the patient warm. Source of hot water is important, like a pitcher of hot water or boiling water that you can pour into that you've measured the temperature so you don't burn your patient, obviously. So you need a source of water. A towel or a cold pack. Remember you talked about taking the washcloth and dipping that in cold water and placing that on the forehead, which again, we talked about an area of cold because we want to relieve the congestion in the brain and the lungs and draw the blood down to the feet. And again, you want to make sure you have that plastic cover on the bed so you don't get the bed or the patient wet.
All right.
So that's pretty much all you need.
Wow, that's simple. Yeah, and we talked about getting these things from your local store.
Yep, it's very easy to get everything.
You don't have to send off to Norway or to get a special Norwegian towel or anything.
No, you don't.
Well, boy, tell us a little bit about the treatment process.
All right. First of all, you're going to have the patient either in lying or sitting with the feet or legs placed in the water and a warm towel around them.
Okay.
Again, you want to start with the bath around 103 degrees, and maybe you can slowly add water, warm water, until you raise the temperature to about 110 degrees. And again, raising the water up the leg as high as you can. You want to do this treatment for 5 to 30 minutes and do it 1 to 3 times a day. And when you finish with your treatment, say it's been a half an hour and they've been in this warm bath, you want to pour cold water over the feet and legs and then dry it thoroughly. What that cold water does is actually closes your pores to act as an insulator to keep the heat. And you want to dry thoroughly following that to avoid chills.
Wow, well that's simple enough.
It is. It's very simple and it feels wonderful.
Well, I see you had a method to your madness here, Amber. Each time we're talking, we're getting a little more involved, it seems like.
Yes.
And I can't wait till we get to the last treatment. Let's just take the next one. You mentioned a neutral bath.
Neutral refers to the temperature of the water. Not too hot, not too cold, neutral temperature.
Oh, very good. Well, and what exactly would I use the neutral bath for?
Very good question. Someone was having fevers and chills, the symptoms of exhaustion, insomnia, they're not sleeping well, inflammation you talked about in the lungs, in the brain and different parts of the body, and abdominal pains from the inflammation in the intestines. All those symptoms would respond very well to a neutral bath.
If they respond, what exactly is the neutral bath doing to me?
Okay. Well, what they see, the physiological reactions are a decrease in pulse rate. Your body can actually absorb water through your pores when you're in the water, so it's good for hydration.
All right.
It decreases nerve irritability. Everyone likes to come home at the end of the day and take a nice warm bath, right? Neutral bath, decreasing irritability. It actually increases the activity or excites the activity of the skin and the kidneys.
Oh.
Yep. And it balances the circulation of the blood through the body. Remember we talked about perfect circulation is perfect health. And if you have areas of inflammation, then blood will be pooling in those areas and that can be unhealthy.
Oh, interesting. Do I need any special equipment?
Well, basically you just need your bathtub, some warm water, and a thermometer. So that's very simple.
Well, most people have that.
I think so.
Tell me about the treatment.
Well, you want to place the patient in the water, in the tub at about 92 to 97 degrees, just below your normal body temperature. That's why you call it a neutral bath. You want to maintain that temperature around 94, 95 degrees, and you want to do it anywhere from 15 to 2 hours.
Oh.
Yep.
Well, 15 minutes to 2 hours. Well, just sit back and relax.
That's right.
Can everybody do this? Is there any precaution?
There are some precautions for using the neutral bath. You want to avoid chilling, so you want to keep the air around the patient at about 75 degrees. Keep the room temperature comfortable so that they don't become chilled. Also, for patients who have congestive heart failure, this is not a good idea for them. So you want to be careful with those patients. And the last thing is patients who have skin lesions or skin wounds. You want to be careful not to soak those for too long because that can be detrimental as well.
Well, Amber, we're covering a lot of ground here. I mean, this sounds like a regular course in medical hydrotherapy.
It is. Layman's medical hydrotherapy.
Yeah, 101 or
That's right.
maybe this is 201 or... The next one you talked about was leg heating pack followed by cold mitten friction.
Yes. You're going to need that plastic sheet to protect the bed because the patient will be using the hot blankets on the bed.
Okay.
You want a cotton blanket or a flannel sheet.
Okay.
For absorbing the water. Also, in addition, you want 2 warm wool blankets, preferably wool.
All right.
It can act as an insulator.
Uh-huh.
And you want, again, sources of hot and cold water and a pillow. So that's really all you need.
How do I do this treatment?
Well, usually they recommend that you start with a warm foot bath. So you're already getting the blood circulating, and you can use this to get the patient ready while you're preparing the leg heat pack. What you want to do is place that plastic sheet over the bed.
Uh-huh.
Then you're going to place those 2 warm blankets down over the bed.
Oh.
Before the patient has had a chance to lay down.
Okay.
You're going to take a cotton blanket or sheet, roll that up, and you're going to immerse that in the warm water.
Okay.
Then dry it out.
Now you said I need to dry out the cotton sheet or blanket. You mean just wring it out
Yep,
and get
just
rid of
wring
the
it
extra
out.
water?
Yep.
Yes.
You want to keep that warm water there, but not the excess water, so the patient's not all wet.
Yes.
So you would use these for symptoms such as the full body ache or the malaise that comes on with the flu. Also the congestion in the lungs, in the chest. Remember you mentioned cyanosis, which is the blue coloring that goes throughout the body, and that's because the blood isn't getting enough oxygen, so it's maintaining that blue color, cool, purplish. Also headaches, sore throat, and chills. These are all symptoms that will benefit from the leg heat pack.
Oh.
So, and the leg heat pack is actually just a progression of the cold or the warm foot bath. In other words, you're just covering more area of the body, so you're addressing more blood vessels so you can affect more circulation.
Well, very good. So it's like a foot bath that goes higher up the leg.
That's right, exactly. And basically, again, you're moving blood to the legs. So you're relieving the congestion and the inflammation in the brain and the chest and the legs, just like you were with a hot foot bath.
Okay.
Again, you're increasing the white blood cell activity to fight off, to increase your immune system and fight off that flu virus. Again, the general warming provides that perspiration to sweat out some of those toxins and stimulating circulation. Before the patient lays down, you lay that down. Then you're going to lie the patient down, have the patient lay down on the bed, then you're going to wrap that warm blanket around 1/2 around one leg, 1/2 around the other leg.
Okay.
And then you're going to take those 2 warm wool blankets and just kind of cocoon the patient, wrap them completely up, and that's going to insulate their legs to keep that nice warm heat around their legs.
And do I need to do anything with the rest of the patient?
As the patient's laying down, you want to place a cool cloth on their forehead. Again, you're encouraging the blood to move away from the brain and upper area and down into the legs. And you want to do that for about 20 to 30 minutes, just have them lying there. You want to follow that with a cold mitten friction, and we'll explain that in just a moment.
All right, so let me just see if I understand this. We're going to take this patient and wrap their legs in a hot, wet blanket or sheet.
Yep.
And then we're going to cocoon them in so they keep that warmth in. Put something cold to their head again.
Yep.
And keep them there for 20, 30 minutes.
That's exactly right.
And then afterwards we're going to do what you call the cold mitten friction.
That's right.
Oh, very good. Why would I use a cold mitten friction?
It's a very good question. It's very good for sluggish circulation, which we talked about with the blue coloring of the patient with the cyanosis. It's following the heat treatment because it kind of increases the stimulating effect. The hot and cold contrast just really gets the circulation flowing. It's excellent for generalized weakness, lack of endurance, the run-down feeling that you feel after a fever, and it also builds up your resistance to cold and the body's resistance to disease. It also increases the skin circulation, improves your heart tone and general circulation throughout the rest of your body. It also, again, increases the white cell activity and antibody production to fight off the influenza virus, and it also reduces fever.
Well, very good. Sounds pretty effective.
It's excellent.
What do I need to do this at home?
Well, first of all, you need a large container that can hold your ice and water. You would like to get mittens, usually of a nice knitted coarse material, rough to the touch. You need a heavy flannel sheet and 1 or 2 towels and a washcloth.
Oh, I've got that all around my house.
I know, very easy. What you want to do is you have the patient lying on the bed covered in the flannel sheet.
Oh.
First of all, you want to take your washcloth and dip that in cool water and just kind of cool off the head, face, and neck area. Wipe that down with a cool cloth.
Okay.
Then you'll take the 2 mittens, the coarse material that we talked about, and you'll put that in the water, just completely immerse it and soak it in the ice water. Dry those off, just wring them out.
Yeah.
And then what you're going to do is slowly uncover one part of the patient at a time. And usually you want to start with the trunk or the main body area of the patient.
Okay.
And so you'll just uncover a portion of that with the blanket, keep the rest of the patient nice and warm and covered.
Yeah.
And you're going to take those mittens with the cold water and just start doing a nice friction massage over the area of skin that's exposed.
Okay.
And you want to do that until you notice the skin start to redden.
Oh.
Sometimes that happens quickly, and sometimes it can take you up to 15 and 20 minutes of rubbing that area to really get the circulation stimulated back to that area.
Wow, sounds like work.
It is. It'll give you a little bit of a workout there. And then what you want to do is dry that area and recover it with the wool blanket, keep it nice and warm, and then progress to the next area. And once you've done the trunk, then you want to work down the arms, the legs, and then you don't need to do the feet. And all throughout this treatment, you want to make sure you keep the patient nice and warm and dry.
I think I could do that. Sometimes I'd like to have somebody do that to me, too.
That's right, a nice massage.
Wow.
If it weren't for all the complications, it might be fun to have the flu.
You talked about fomentation. Tell us a little bit about fomentation.
Fomentations, it's kind of a big word to swallow at first.
Yeah.
Basically, it's applying heat to the body. Again, using the principles of dilating the blood vessels, to relieve tension, to relax the muscles, to relieve pain. And one of the most simplest and effective ways of doing that is by using a fomentation. And a fomentation is anything such as a blanket, a towel, gel, anything that's warm that can apply heat to the body.
Oh.
So that's basically what a fomentation is. It's applying moist heat to a local area.
Okay.
Usually better results are obtained if the application covers a somewhat larger area than the affected area. Say you wanted to cover the area just above or maybe the abdomen. If you cover a little bit larger area than just the abdomen, usually you get better results.
Okay.
And for the best reaction, you want to apply the heat immediately following a short application of cold. So this helps maintain the desired effect.
Well, what would I use a fomentation for?
Well, many of the symptoms you described from the flu, such as relieving congestion again from the chest, coughs, colds, bronchitis, pneumonia, influenza, all of these problems can usually benefit from the fomentation.
Well, from the fomentation.
Also reducing inflammation in the intestines. We talked about the blue coloring, the cyanosis, from the sluggish blood flow, the congestion, all these disturbances that are caused by the lack of circulation can be improved with fomentations.
Well, great. Wow. What is the fomentation actually doing to me?
It actually stimulates tissue activity by quickening the circulation, increasing your metabolism, increases the body's temperature.
Okay.
Promotes increase in circulation of the white blood cells. It enhances stimulation through sweating, again the perspiration eliminating the toxins, and relieves muscle spasms, increases circulation, allows the muscles to relax, pretty much relieves pain from the internal organs as well. So it's very helpful for many of the symptoms with the flu.
Wow, sounds like a cure-all. And what equipment will I need?
5 fomentation pads are what is recommended, and that's because often the pad or whatever you're using to apply heat will cool down, and you want to be able to replace it with the next one. So I usually recommend having 5 on hand. And that can be any product, like we talked about, gel packs, clothes, blankets, anything that when folded up into a thickness can be used to apply heat to a certain area.
Okay.
You also need a heating device, such as a kettle or a steamer, microwave, etc. 1 large warm blanket, wool preferred. Again, using it as an insulator. 1 sheet and 1 pillow.
Okay.
You also want to have 2 large buckets, one used for a foot bath to be formed while you're doing the fomentations.
Okay.
Water thermometer and oral thermometer so you maintain your temperature that you're looking for. 10 towels.
Wow.
Yes. And a cloth for wrapping and cooling off the head. Basins of water, ice, plastic bed sheet. Again, you always want to protect the area that the patient is lying in, and Vaseline.
Take us through how one of these treatments would progress.
First of all, again, you always like to start with a hot foot bath so the patient is getting their circulation going while you're preparing and setting up for the fomentation. You want to keep the room temperature, again, about 75-80, keeping the patient from becoming chilled, keeping them comfortable, keeping it free from breeze. You want to place that plastic bed sheet over the bed to protect from moisture.
Yeah.
And then whatever area you're going to treat, you take that Vaseline and you rub it into that area.
Okay.
You put a cool cloth on the forehead, and then you're going to place the fomentations into the hot water until their desired temperature. And then you remove them and wring them right out.
Wow.
Then you're going to place a dry towel over the area that you just applied the Vaseline to, the area that you want to treat, and place that's going to protect that area from being burned or too uncomfortable from the hot fomentations. You want to always protect the patient. Then you're going to put that fomentation, whatever you're using, again the gel or the towels, over that patient. You want to leave it in place for 3 to 5 minutes.
Okay.
And then when that has started to cool a little bit after 3 to 5 minutes, you remove it. And you always want to, after that fomentation, rub that area down and make sure it's nice and dry before you apply the next one. Wiping the moisture off the skin before applying the next fomentation is important. All changes should be made quickly. You never want to leave that area that you're treating exposed for too long. And if the patient is perspiring a lot, you want to make sure you dry that area before putting on the next fomentation. And replace it with another one. And you want to repeat that about 2 times. Once you've completed all 3 fomentations, you want to rub that area down with a cloth soaked in ice water and then dry it thoroughly. Always end with the cold.
Oh, I look forward to that.
I know. But it's important.
Has any patient ever gotten burned with these?
Yes, you have to be very careful. I've seen a lot of skin redness. If you're not careful to make sure that there's enough insulation between the fomentation and the skin. So even between applications of one to the next, you always want to check the skin and make sure it looks healthy and not too overly red.
No red lobster.
No red lobster, even in Maine.
Well, very good. Are there any other precautions I need to keep in mind?
Yep, just like we said, again, making sure the patient isn't chilled, keeping that room temperature about 75 degrees. You always want to make sure the patient's feet are kept warm.
Okay.
And you always want to keep the head cool.
This sounds like a fairly involved treatment, but I think it's something that most people can handle.
Definitely. Actually, there's a way to progress that if the patient is getting more severe in their symptoms.
Yes, the fomentation is very good about moving blood around the body. But sometimes these patients are resistant to having that blood moved. And especially if they're going into the pulmonary edema and hemorrhagic pneumonia, when they're having the cytokines, the extra inflammation in the lungs, and you're having trouble getting the blood to move away from there, they're still congested, still having trouble breathing, then we would do a little different process where instead of putting the fomentation or hot pack to the front of the chest, we would put the hot pack to the back of the chest and put a cold pack on the front of the chest. What this is doing is you have the patient lay down on the hot pack, and it helps the blood to move out of the chest into the vessels that go between the ribs, the intercostals. It pulls blood out of the chest that way. The cold pack to the front of the chest causes a reflex constriction of the pulmonary vessels. And that way, you have a double whammy. You've pulled blood out, and you're causing the nervous system to shrink the vessels from the front. So cold in the front to shrink the vessels, to cause a vasoconstriction. Hot pack in the back to cause vasodilation and pull blood back into the intercostals. This should help get the blood out of the lungs, decrease the congestion, get the blood moving, because we know that perfect health depends on
perfect circulation.
That's
and
right.
The one thing you want to be careful with this one is when the patient is lying on the hot pack, that can be a little bit more aggressive. So you want to make sure there's enough padding there and check the patient so you don't burn their skin.
That's right. Burnt patients don't generally come back happy.
No.
Well, we've covered quite a few interesting treatments.
Yes.
I'm glad we're learning these things, because if that flu comes through, some of these could be very helpful.
Very helpful.
Yes, and when those patients come down with this basically, killer disease that could kill, they're thinking up to 2 million Americans, and some people say that's conservative, then having some treatments to do at home would be very good.
Definitely.
The next one you talked about was the abdominal cold compress or ice bag.
Mm-hmm. Well, you would want to use this with some of the symptoms like nausea or loss of appetite, fever, or just general pain from congestion in the internal organs and edema in those organs. The effect it has on the body is it increases circulation in those internal organs. It also relieves the passive congestion. It stimulates the immune system and increased resistance to the influenza virus, and it also relieves pain due to the edema and the trauma.
Well, that sounds practical.
Very practical.
Somebody's going to need that.
Yes, and it doesn't take much equipment at all. Really all you need is a source of ice or cold, such as a freezer or water with ice in it. And you need a cloth that can be wrung out from cold or the ice pack, or a nice gel pack.
Simple equipment.
Yep, and what you do is you just place that gel pack or that cold pack right over the abdomen. You can apply it over the entire abdomen or specifically over the area that they're complaining of pain. Perhaps if there's liver inflammation, you want to place it right over the liver area. And you want to leave that pack there and change it every 4 to 5 minutes so you maintain that temperature. You can also place it over the heart as well if the patient is having rapid heart rate, and that helps to slow down the heart rate.
Is there anything I need to worry about?
As always, you don't want to chill the patient. You want to make sure they're nice and comfortable. Don't drip cold water on them. You want to avoid wounds, skin disease, and a diabetes candidate may not be good for this treatment. So, and some patients can't tolerate the cold.
Yeah, so if the patient's already freezing, don't pack them in ice.
That's right.
Well, Amber, we've covered a lot of ground today.
Yes.
Or a lot of water, I should say.
Very good.
And I think we're ready to talk about a hot and cold abdominal pack.
Yes.
What would you use one of those for?
Abdominal or stomach pain, vomiting, diarrhea, fever, peptic ulcers, all those types of symptoms that go along with the flu that you'd want to be addressing.
What does this hot and cold abdominal pack do to you?
It's very similar to the contrast treatment you were using with the fomentations. What you're going to basically do is put a hot pack or hot application, a hot fomentation on the lower back, and that again draws blood through the lumbar veins, the veins on the back of your back, and diverts blood away from the intestines, which is where you're having that abdominal pain. It increases the circulation and it increases the immune response. At the same time, you're going to put a cold pack on the abdominal area, again encouraging blood to flow towards the lumbar veins.
Pretty effective, huh?
It is very effective.
Boy, what equipment will I need for doing this?
You're going to need a cloth to be wrung from the cold, or ice water, or a gel pack, something that you're going to apply the cold with. You're going to need your source of cold, either the freezer that you put the gel pack in or the ice water that you're going to put the cloth in. You want your fomentation or gel pack for the back, how you're going to apply the heat. And you also want the blankets and the towels and the plastic to keep the patient warm and protect the bed area to be kept dry.
Easy.
Yes.
Wow. Boy, maybe we could start doing this for a business.
We could.
If the bird flu comes around, we'll all be in the business. You will be in the business.
That's right.
So, tell us how we perform this treatment.
All right. Well, what you're going to want to do is apply the cold compress over the whole abdominal surface.
And does that cold pack affect the vessels in the intestines?
Yes. Again, it constricts those veins. So again, encouraging the blood to flow out to where the veins are being dilated by the hot pack.
Oh,
So
great.
you're circulating the blood away from the intestines and out the back. And a
Uh-huh.
hot pack is applied over the lower back region, especially on the left side where the veins are going to be pulling the blood.
Uh-huh.
The cold compress should be renewed every 1 to 5 minutes. Again, you're going to want to be keeping those gel packs in the freezer and just rotating them. As it approaches body temperature, as the cold pack's lower, you want to reuse a new cold pack.
Oh.
And between each treatment, you want to make sure you dry off the area that you're treating and keeping that area nice and dry and keeping the rest of the patient nice and warm.
Wow.
And then at the same time, you want to have that hot fomentation or that hot pack on the black. And that can be exchanged every 15 to 20 minutes. Again, you want to be very careful that you don't burn the skin and make sure there's enough insulation there that you're not getting the skin too red or burned. After about 20 minutes between applications, you want to take a nice cold friction massage and just quickly rub the area down, make sure it's dry, and then again apply the heat.
Oh.
And you can continue to apply heat between friction massage and cold for anywhere from 15 minutes to 2 hours until you reach the desired effect that you're looking for, such as increasing or decreasing the abdominal pain that the patient is having.
Is there anything I need to worry about on this particular application?
Again, anytime you're using cold, you want to make sure that the patient doesn't get over chilled.
Oh.
And that you don't drip any water on them. You keep them nice and dry. Again, you want to be careful with patients who have certain diseases such as diabetes.
Okay.
They don't respond as well to the hot and cold treatments as the normal population might. And again, some patients can't tolerate the cold.
That sounds like a application we could do in the home.
Very easy. All of them are very easy. The equipment is easy. And once you understand the principles, it's very effective treatment. So we've discussed many ways to use hydrotherapy, the use of water in the hot and cold to address the different problems and symptoms that come along with influenza. Again, the main principle is to keep circulation in the body, nice healthy circulation, and to decrease inflammation and congestion that might be happening in one part of the body, dilating the blood vessels in another area with heat. And using those principles, we can maintain circulation and address the many symptoms of inflammation throughout the body that are caused by the flu.
Yeah.
So it's been very helpful. The hot bath, the hot leg compress, the abdominal cold and chest packs and fomentations, all using the same principle of maintaining circulation, which is going to help the body maintain perfect health.
That's right. Very good.
Well, some of the other treatments that we can use, in addition, we had mentioned charcoal at the beginning when we had talked about taking the hot and cold shower and then taking a couple glasses of charcoal to get rid of some of the toxins. Let's go a little bit more in depth into the use of charcoal for some of these influenza symptoms, if you don't mind. I'd like to ask you a couple questions about that.
Sure.
Some of the symptoms that we can treat with the charcoal. Can you review those with us?
Yes, the charcoal is very handy. You can use it for a lot of different problems. And we talked about the different symptoms. The sore throat, that was the reason we were taking it by mouth, is helped by the charcoal. Even the body aches. You see, those body aches are often the influenza virus sending toxins throughout the body. The charcoal helps to absorb those toxins. And then there's the inflammation of the lungs that causes what we call the cytokine storm, the hemorrhagic pneumonia, the inflammation of the lungs that kills people. Charcoal is very important for reducing inflammation. And then there's inflammation around the eyes. These people have the red eyes. Charcoal is very helpful. We'll talk about how to use it there. Anti-swelling. Diarrhea can be helped with charcoal. And then there's nausea and vomiting. And this can be a big problem if you're losing lots of fluids, and charcoal is a big help in this area as well.
Okay. Wow, it sounds like it addresses a lot of the symptoms, just like the hydrotherapy does.
Sure does.
What type of equipment are we going to need for doing charcoal applications?
Well, first of all, you'll need your charcoal. You don't want charcoal briquettes from your grill. What we're talking about is basically a commercial product that you can buy. You can make it yourself, though. One of the ways is if you have a wood-burning stove, is just shut the damper and shut the air intake on it once it's gotten to a good burn, and let it just sit there and burn itself out. The heat in the stove will reduce most of the wood in the stove to charcoal. People who are making this out in the countryside will often take and dig a hole, put a bunch of hardwood in the hole, preferably already dry, put a metal piece over the hole, any metal you can find, the hood of an old car, and then build a fire on top of it. And basically what you're doing is you're taking wood, heating it to the point that it would burn, but in an oxygen-free environment, so it all reduces down to this black chalky stuff. Well, some people have talked about they just go out and find an old burnt tree, shave off the charcoal, grind it up, and use that. It's not quite as effective as activated charcoal, but it is charcoal all the same, and it will work. So, but if you buy your charcoal, you want activated charcoal, you can buy it at charcoalremedies.com. There's other places, just look it up on the internet, you can buy it. A lot of health food stores will have it or can order it for you. Then you want a 1-pint jar, a flour sack that won't let the charcoal sift through, but it's made out of cotton, so it is absorbent. You want something to thicken some of the charcoal for some of these applications we'll talk about. Cornstarch or ground flaxseed. And then paper towels. So that would be our equipment.
Sounds pretty easy. What type of effect does the charcoal have on the body?
Charcoal's main effect is it is a super adsorbent. It'll pull all kinds of toxins, gases, chemicals, viruses, bacteria, inflammatory fluids out of the body because it absorbs on all the surfaces of all that charcoal. So it's quite a super adsorbent.
Excellent. Well, you mentioned some of the different symptoms or indications it's used for, and so let's talk about a little bit of how would we use it to treat those symptoms. For instance, the sore throat, the body aches, nausea, vomiting, and diarrhea. Let's take those symptoms. What would you use the charcoal for? How would you address those symptoms?
Yeah, Amber, we're basically talking about problems with the alimentary tract, the mouth, esophagus, stomach, intestines. We're talking about the whole system there. And so basically you can take this stuff by mouth and it travels through you. And you know when it comes out because it's black. So what I usually do is I take 2 tablespoons of the charcoal, put it in a cup of water. Usually I put it in a jar that has a little extra room so I can add the charcoal, and then I shake it. And it mixes the charcoal in with the water, and then I drink it down. And sometimes you have to jiggle it a little bit to keep the charcoal in suspension, but drink it right down. And it's very effective. I've used this on people who had other problems with their stomach, intestines. It's very effective. It's effective for Crohn's disease. It's effective for a lot of different problems people have. But for the flu, it'll help pull the inflammation out. You see it comes down the esophagus, that goes right by the lungs and heart. It goes into the stomach, that's right by the spleen and the pancreas, the liver. It goes right through the small intestine and large bowel, and helps to reduce the inflammation these viruses are causing. Helps pick up viruses and carry them out as well.
Excellent.
So it's very effective.
Excellent.
Oh, wow. Yeah.
I'll let you go first.
Oh, good. I love this stuff.
Don't take it all, Elaine.
Yeah,
Oh, come on.
it's really black, ain't it?
Oh, this is good stuff. Oh, yes. Wow.
There you go, Amber.
Thank you.
Leave some for the doc.
Oh, good stuff, man. Can't keep the kids out of this
Make
stuff.
sure you keep your cover on tight.
Spilled it everywhere.
Yeah, I'm putting my lid on here because we gotta shake this stuff up good.
Ooh-wee.
Whoa, isn't that pretty? Man, mouth-watering good. Look out when you take the lid loose, it might spit on you.
That's true.
Okay. Wow.
Chug-a-lug.
Yeah.
Cheers.
Cheers, okay. Boy, great stuff. Nothing like calling the kettle black.
You polish that off real quick.
I don't fool around. When I want to get rid of something, I do it fast.
All right. All right.
You look really good.
Everybody smile at the camera.
Well, how about for inflammation and swelling? How would you use the charcoal to address those?
Inflammation and swelling. Depends on how large an area you want to treat. What we want to do is make the charcoal so it will basically stick to an area, so it doesn't just run out. It's hard to use charcoal. It's in this liquid we just drank. Well, you couldn't put that on a body part. So, those of you who are cooks, mix it with something you like to thicken things in cooking. We often use cornstarch or ground up flaxseed. And the proportions would be 3 tablespoons of flaxseed or cornstarch to 3 tablespoons of charcoal. And then add enough water, about a cup, to make a good amount of charcoal poultice and heat it up so it thickens. You don't necessarily want this stuff right on your skin. You don't have to have it on your skin. It'll still work. It doesn't have to be touching the skin, believe it or not. And when I first heard that, I kind of wondered about that. Doesn't this stuff have to touch the skin? Well, the skin's between it and whatever you're trying to treat, so why not put something else in between too? And so what I do is take a paper towel, one that's of good integrity that won't just fall apart. Take your charcoal mixture you just made and spread it over that paper towel for as big areas you're trying to treat, and put it about 1/4 of an inch thick, and then fold in the edges of the paper towel over it, or put another paper towel over it, so that you basically have the charcoal so it won't get away from you and get on everything. And then take that poultice and place it over the area you're trying to treat. And in this case, we might do this over the whole abdomen or chest. If they're really getting in a lot of trouble with their lungs and chest, this will pull the inflammation out of the pleural linings, even out of the lungs. Very effective. And so for the influenza, where you might be having respiratory distress, then using this charcoal on the chest or even the back could be very effective. Could be a last-ditch measure when the patient's not doing well.
Okay. You talked about treating inflammation. Can you talk a little bit more about treating inflammation in the eyes and chest and abdomen area?
The eyes are very important. They're actually an extension of the brain out to the front of your head. So they're one of the few places you can access the brain easily. And these patients get inflammation of the brain, meningitis, they get brain edema. Patients who were autopsied from the bird flu in 1918 had their brains swollen. The rugae, or the grooves in the brain, had almost disappeared with so much swelling. And so doing a charcoal treatment over the eyes, both for the pain of the headaches and for the eye pain and for the brain swelling, can be very effective. And the way I would do this, we would do this kind of like what we call a charcoal fomentation. A charcoal fomentation is basically where instead of using a gel pack, we're using a charcoal pack.
Okay.
So this is what I use those flour sacks for. I mentioned earlier that people needed to have in their armamentarium of stuff to treat people with. Take these flour sacks, fill them with enough charcoal that they can cover the area to be treated, and then dip them in hot or cold water, depending on what effect you want. So for the eyes and the brain, you're trying to take the extra blood away from the eyes and brain anyway. I would do either a heating leg pack or the hot foot bath. Probably the hot foot bath is the easiest. Have the patient all set up with this, and then take this charcoal fomentation, dip it in cold water, and put it over the eyes and the front of the face and the forehead, and have some way of holding it there. And that would be your cold application, but it'll also pull the inflammation and extra swelling out of the eyes, out of the brain, out of the frontal part of the head, in order to treat these inflammatory problems. Very effective. For the chest, you could use the fomentation when you're doing either hot, you could use a charcoal fomentation, a bigger flour sack or bag or whatever with this charcoal in it, or you could do it over the abdomen and pelvis for the inflammation down there, which patients often complain of. So very effective way of treating them is actually making the charcoal into a fomentation and taking advantage of its absorptive properties in the process.
Excellent. Well, it sounds like we're addressing inflammation throughout the body. What about some other symptoms such as bleeding from the nose or rectum? Can we use charcoal for that as well?
We sure can. That's not a very pleasant thing to have happen to you.
No.
And bleeding, believe it or not, has been treated with charcoal. It's been described as used for rectal bleeding, intestinal bleeding, internal bleeding. And so it can be used, basically, the same mixture we talked about to drinking, you can put in other parts of your body. You can send it up as an enema. And so your 2 tablespoons in about a cup of water or half a quart of water, whatever works good for you. Put it in your enema bag and send it into the colon from the rectum. And the charcoal has a tendency to absorb the toxins, which may be causing the body not to coagulate like it should. And you can do the same thing for the nose. Use the same material. Use an ear bulb you can buy down at the pharmacy, or any other thing you can use to get the liquid squirted in the nose. And it both absorbs toxins and it does have a tendency to stop bleeding.
Okay. So you can actually go down to the local pharmacy then and get one of those little enema packets.
Yes.
And dump out whatever's in it and put in the water and charcoal and use that to administer a charcoal enema, which will help with the blood coagulating and stop some of the bleeding that's in the rectum. And you can do the same with the nose. That's
yes, that's right. Yeah, and people back in 1918 reported bleeding from their ears, nose, mouth, all the parts of the body. And so this is one thing that can be used along with cold. In this case, I would use it probably as cold as you could stand, because that also helps constrict vessels that might be bleeding.
Any precautions for using charcoal in this manner?
There's no major precautions, but it is true that charcoal put in any kind of wound can accumulate there and remain there for a long time, and you might end up with a tattoo. And the tattoo wouldn't be good, because patients will remember you that way for a long time, and it might not be a pleasant memory.
That's right.
But at least if they survive, maybe it'd be worth it. Maybe it'd be a mark of distinction.
There you go. Well, sometimes it's hard to understand with all these symptoms that the patient is going through. They come in and are they just with the fever and the chills and the ache, or have they progressed to coughing and perhaps the inflammation, the redness behind the eyes, the headaches, the abdominal pain, or have they progressed to actual blood in the nose and in the rectum? Is there any type of method to the madness? What do I address first? What do I, if they come in with all these symptoms, which way do we go?
It can be pretty confusing, can't it? What do I do first? And I kind of looked to my trauma training to think about this. And I think the protocol we use for trauma would work well in a little adaptation to the flu.
Okay.
And in the trauma, we have what we call the ABCs. And then we also go down the alphabet a little farther than that. And the first thing I would say is make sure they have a good airway. In this case, when they're coughing up, vomiting, when they're bleeding and so forth, or just starting out the flu, just make sure that they have a good access to air through their nose and their mouth. Make sure it's not obstructed by anything. Make sure if there's anything you need to do to clear the airways that you've done it. So basically, survival. The next thing is, are they breathing well? And this is a little more involved than with the trauma situation, because we're talking about the lungs here. And all the things that can happen to the lungs. The flu especially knocks out the lungs. We're talking about blood in the lungs. We're talking about inflammation that they call cytokine storm. In this case, you can start applying your hydrotherapy measures that will affect the lungs. Fomentations, contrast fomentations, charcoal fomentations over the chest, steam inhalation, getting the airways cleaned out and the mucus moving. We're talking about doing all the things that we learned here today that will help the lungs. Walking out in the fresh air is also about keeping the lungs going well. And so getting the breathing going, maximizing the breathing, making the lungs as healthy as possible. Then there's even the nutrients we talked about in the prevention session on what to eat in order to keep the lungs from becoming susceptible to cytokine storm, keeping the lungs from going into major meltdown, inflammation. And so there's all the different aspects of keeping the lungs in good shape.
Okay.
The third thing, the C, is circulation. In this case, we want to make sure the circulation is good. There's something about the influenza, something about the pneumonias that causes a dysregulation of the blood flow throughout the body. It totally messes it up. This is why these patients turn blue on the surface. It has a lot to do with the vessels dilating too much, becoming too sluggish, the circulation not making it back to the heart and lungs well, as well as the lungs not picking up oxygen well. So keeping the circulation going well, start out with making sure the heart's working well, make sure that they're breathing well, we already talked about that, and then the circulation, we're talking about the peripheral circulation. If they're having this blueness, we talked about the mitten friction, foot baths and the leg packs are very helpful at getting the circulation, decompressing the extra blood that's collecting in the lungs, heart, and head, and pulling it away, balancing the circulation this way, the tepid bath or the warm bath. And so everything we can do to get the circulation going is important. There's also the fact we talked about water, drinking water. If your vessels aren't full of water, your body has a harder time juggling where the little bit of water you have goes. And so if you can get more water in the system, get it coming and drinking it and soaking it in a bath, enemas if you have to, getting plenty of water in the system so that the circulation will be balanced. Then we add the D, which we call the doctors. We'll call that the 8 natural doctors. Remember in the second session we outlined those quite specifically, and so I would go to those 8 natural doctors once you've taken care of the airway, breathing, and circulation. Then concentrate on the 8 natural remedies that are both for prevention and for cure. And I think if you follow this outline, you'll have a good sequence that you can follow for treating any patient that's coming down with the more severe symptoms of bird flu.
Okay.
Now, patients who have the influenza are not out of the woods for 3 weeks to a couple months.
After having the influenza virus.
After having the virus takes a lot out of you. Takes a lot out of your immune system. And so even if you've had the flu and you think you're out of the woods, you're feeling well, for a couple months until those cilia grow back, until the lungs get back in good shape, for the rest of your life for that matter, follow those prevention guidelines we talked about in the prevention video. Make sure you're doing all that stuff.
To build up your immune system.
Build up your immune system, the 8 natural doctors. Make sure you have a good chance at survival.
Well, can you give us a little bit of a summary about what we've talked about today, Dr. Clark?
Yes, we've talked about a lot of things, and you'll probably have to go back and review the tape some, but as with the 1918 bird flu, medical science has its limits. There's only so many of us doctors around, there's only so many facilities, there's fewer beds now available than there was in 1918 due to managed care, cutting down the amount of time people spend in the hospital and the reasons they can be admitted. And so you want to make sure that you have a way to treat yourself at home, if out of necessity because you can't reach a doctor, or if because what the doctor has for you isn't as effective as what we've talked about today. The seasonal flu is bad enough. Bird flu progresses to viral or even bacterial pneumonia, cyanosis, and death. And so it's something that you want to stop in its tracks long before it approaches death. Prevention is the best treatment. But once you think you might be coming down with the flu, then you want to use the 8 natural doctors. You want to do some of the early hot and cold showers that we talked about, charcoal. If it progresses, then we want you to use hydrotherapy. And basically you're trying to get the circulation going well throughout the body. You want to decompress congested areas where there's too much blood. And in the prevention talk, we talked about if you're running around outside with cold arms and legs, you're going to be congested anyway, and it's not going to help you. But the hydrotherapy then is our way of increasing the immune system, getting the white count up, getting the blood circulating evenly through the body, getting it away from congested areas, because perfect health depends on
perfect circulation.
Okay, and we just want to mention that if you want more information on hydrotherapy, there are books you can obtain. I've got the Wildwood bookstores number up here on the screen for you. 706-820-9955. That's 706-820-9955. Well, thank you for spending your time with us today, taking the time to watch this DVD. I hope you aren't dying, trying to hang on to your remote, trying to figure out how to heal yourself. Hopefully you've watched this before the flu hits, but I hope you have the tools you need to treat the people who come to you for treatment or treating yourself.
Thank you for being with us today.